Hypnosis has long been shrouded in a veil of mystery. Even Count Dracula used hypnosis to subdue his victims. Hypnotherapy works, though. It can be used to treat a wide variety of issues, mental, physical, and emotional. Research shows that hypnotherapy is effective, and any concerns that a patient may have can be alleviated by dispelling the misconceptions related to hypnotherapy. Best of all, these hypnotic techniques can be practiced and used anytime in any situation of stress and anxiety. Understanding the fundamentals of the process will help to alleviate any concerns. Everyone has been in a hypnotic state at some time. If you've ever been lost in a book or a movie or a game, that's a trance-like state. Some people are more susceptible to hypnosis than others. In the late 1950s, Stanford University did studies into hypnosis and found that about 95% of people can be hypnotized. People vary in their rates of susceptibility to hypnosis. And also this rate of susceptibility is very stable over long periods of time. The hypnotic subject is very responsive, active problem solver. Their readiness for change and their susceptibility are big indicators of how successful therapeutic hypnosis will be. Focusing on the hypnotherapist's voice, listening to the positive suggestions will help the patient implant these ideas deep in their subconscious. All hypnosis is ultimately self-hypnosis. The neuroscience doesn't specifically understand the mechanisms by which hypnosis works, but it does understand there's a suppressing of the conscious mind to allow the unconscious mind to explore more deeply. Ideas adopted at this deep subconscious level can help to retrain behavior and promote change from deep within. It should be understood that there's no concern that a subject hypnotized will lose free will or moral judgment in any way, or do anything that they wouldn't ordinarily do. Now that we've understand some of the fundamentals of therapeutic hypnosis, let's look at some of the uses. Therapeutic hypnosis has long been used to treat stress and anxiety. It can also be used to treat phobias of any kind. It has been used to treat addictions such as smoking and alcoholism. And for centuries, they've used hypnosis to help people tolerate pain associated with surgery, dentistry, obstetrics, and illness. Now that we see the usefulness of hypnotherapy, let's challenge some of the misconceptions. A qualified hypnotherapist can put the individual into a trance state. And in this state, they are highly open to the positive suggestions of the therapist. If they have a good clinical rapport with the therapist, it's helpful for them to relax and trust him and go into a deeper state, trance. Patients still need not worry about saying or doing anything that they wouldn't ordinarily do. The free will and the moral judgment are not suspended in any way. The patient is not asleep during hypnotherapy like many people think. Instead, they're highly alert and focused on the therapist's voice. The patient doesn't ever lose consciousness or memory, but the body is released from active control of the environment. Now, some of the myths have been debunked. Hypnotherapy has been demystified. We can see its therapeutic usefulness. Hypnotherapy is a safe and effective treatment for a wide array of mental disorders. The practice has existed for centuries with well-documented success, but apprehension on the part of some still persists. There should be no concern about a loss of control during hypnosis. In fact, a willingness to be hypnotized and a desire for change are strong indicators of the success of the treatment. In today's stressful world, a simple, safe, effective method to ease our troubled minds and alleviate our pain is invaluable. And best of all, these methods can be learned and practiced so that we can use them in any stressful situation.